Hello, everybody. Thank you for watching Just Upright channel. Be sure to check my other videos that I have made in this channel. So this is a very special presentation because I am so passionate about fall prevention. So for those who haven't watched any of my videos, my name is Ching Ruder. My real name is Gina Lynn, but I go by Jing, like Jingle Bells. I'm a physical therapist. I'm currently practicing here in Missouri, USA, and I used to be a review lecturer in the Philippines. So I entitled this presentation, The Most Neglected Key Muscles for Balance. And I will discuss why and what are the things that we can do to improve our balance and activate these muscles that I'm talking about. So the muscle that is of special interest is the calf muscles. These are the muscles at the back of your legs. And, you hear sometimes the word gastrocnemius. So these are the gastrocnemius muscles. It bends your knee because it crosses at the back of your knee and it makes your foot point downward. So we call that plantar flexion. So they are plantar flexor muscles. The soleus is underneath the gastrocnemius, it's deeply seated. And then we have the front lower leg muscles. So these are the dorsiflexors. So the dorsiflexors, if this is your lower leg, this is your foot. So the dorsiflexors are the muscles that move your foot to point your toes upward. Okay. So these are the ankle motions. So we have the dorsiflexion is your toes and your foot moving up. And then your plantar flexion is your foot and the toes moving downwards, so pointing down. So this is just for a reference that the normal dorsiflexion, or the amount of movement of the foot going upward, is round about in the 20 degrees for the non-weight bearing, and for weight bearing we needed more, like a 33 degrees plus minus 5 degrees. So this is from Bombach et al., the research study in 2016. So why am I targeting this muscle? Because I have had so many patients with who has fallen a lot, and every time that I assess my patient or evaluate my patient who has fallen, or whenever I see how they're walking, I assess the range of motion of their ankle. And I want to see how much their dorsiflexion is. And most often than not, the limitation of the dorsiflexion is due to the tightness of the calf muscles. So there are so many reasons why the calf muscles become tight. One of which is that the resting position of the foot. We favor the resting position with the toes pointing down. So that is the relaxed position of the foot. And in that position, the calf muscles are already like in a shortened position. Plus, if we don't stretch every day as we grow old, our muscles get tighter and tighter, particularly the flexors of the lower extremity or the legs. So what are the effects of tight calf muscles? So if the calf muscles are tight, it will affect the ability to stand up, because in this picture you can see that the person's feet are behind the knees in relation to vertical position. The knees are more forward and the foot are more here behind the ankle, behind the knees. So if a person has tightness of the calf muscles, it's very hard for that person to put or position the feet backwards while keeping the feet flat on the floor. So it is harder for us to stand up if our feet are way forward in relation to the knee. And when once the patient is standing up, And if their calf muscles are so tight, I have had a patient, a gentleman maybe in his 80s, and his calf muscles are very, very tight, and he needed two people to stand him up. But while standing, he was leaning too far back, and he needed, a maximal assist of two-person to just stand up. So in people with tightness of the calf muscles, they don't have, or they have what we call decreased heel strike. So this is the heel strike part of the walking cycle. So heel strike, it is called heel strike because normally the heel is the first to strike the ground, just the heel, not the entire foot. But if your calf muscles are so tight, instead of your toes being this high from the ground, it will be lower. Or some of my patients, the first part of the walking cycle or the stance phase is actually foot flat because it's so tight, this calf muscle so tight, pulling the foot to move, to point down, so you have limited dorsiflexion, you have a lot of plantar flexion, so that impairs your balance. So just to recap, if the calf muscles of a person is tight, it's hard to do sit to stand, especially if you're not going to use your hands to push yourself up. Once you're standing, some people need to grab onto something because they feel like they're falling backwards. And then those people with maybe mild moderate tightness of the calf muscles, they have decreased, and in severe cases, no heel strike. So it's easy for them to trip over anything. And in severe cases, they can even trip their own toes. So there are evidences available in the internet, and I will just go breeze through these evidence here, and you can find the reference at the end of the presentation, the end slide. So Whipple et al. Studied the relationship of knee and ankle weakness, and they found that fallers actually have weakness of the knee, flexors, extensors, ankle dorsiflexors, and plantar flexors. But among all the muscles, they stated that dorsiflexors appear to be the important underlying factor for poor balance. So Kemun et al. Concluded in their study that ankle dorsiflexion delays appear to be predictive of fall in older adults. Neitz et al. In 2004 studied the relationship between ankle dorsiflexion range, falls, and activity level in women 40 to 80 years old, and found there was limitation of active dorsiflexion range in older women that might contribute to fall. So important risk factors for fall, according to Metz et al., include ankle flexibility is reduced, the severity of hallux valgus, decreased tactile sensitivity, decreased toe plantar flexor strength, and disabling foot pain. And then Johnson et al. In 2007, they did a study of stretching, the effect of stretching of the muscles we talk about at the back of the legs, the gastrocnemius and the soleus, in a lunge position, so lunging position like this, but they used a chair as a support. And they asked the participants to hold this for 60 seconds, 4 times per limb, and then do this 5 times a week for 6 weeks. And what they found, that within the 6-week static stretching of the calves, it improves the ankle dorsiflexion of older women to as much as 12.3 degrees. So that is significant improvement in range. So meaning if you have increased ability to improve your dorsiflexion, the risk of falling is decreased. So other evidence, the most recent one is Gose et al. In 2015. This is about fibromyalgia patient, and they actually found the higher number of falls is related to reduced dorsiflexion during stance phase, and they actually said that intervention to increase dorsiflexion may be beneficial for patients with fibromyalgia to decrease the fall risk. The next one is Takatori et al. In 2015 found that research participants who had fallen in the past 6 months had lesser toe elevation angle compared to who did not fall. They concluded that toe elevation angle was an index of dynamic balance and appears to be a simple screening test for fall risk in community dwelling older adults. And then lastly is Narduzzi in 2017. She studied the effects of static versus dynamic stretching on fall risk, balance, and muscle function in older adults. And she mentioned that her study was the first to report that static stretching of gastrocnemius and soleus immediately improved the muscle activity within the stretch muscle, and the study promotes static stretching for 135 seconds, so more than 2 minutes, to allow for improved activation of the soleus, reduce fall risk, and improve balance in older adults. Now, before you go ahead and exercise, please consult your physician if you are cleared to do this exercise, if this is safe for you, and by no means this is a replacement for physical therapy consultation. So just be clear that you should be cleared by the doctor to do any of the exercise that I'm discussing here. I am not going to be liable for any injury you might incur. So there are so many ways to stretch the calf muscles, but this is the simplest way that I found work for my patients. Because if you make things complicated, life is busy, and they will not be compliant with the home exercise program. But if it is easy and they understand what it is for, they find value in the exercise, they will do it. So I usually tell my patient to have at least start with a 2x4 wood, place it on the floor just like what you see on the picture, put their toes on top of the wood, the heel will stay on the floor, and keep the knee straight, tuck their bottom in, tighten up their tummy, keep everything straight, don't stoop forward, and if they can, do it simultaneously, both toes up here, depending on their balance, and hold on for support, and hold the position for 30 seconds to 1 minute, and do that 3 to 5 times, 3, 4, or 5 times per day, every day if they can, if not 3 times a week. And that should promote improvement in the flexibility of the calf muscles, at the same time increasing the dorsiflexion of the foot. So as we had seen in the study, that if you have increased dorsiflexion, if you have flexible calf muscles that causing increase in dorsiflexion, the risk for fall is decreased, and your balance will be better, your posture will be better. So and the quality of your walking will be better. You will have actually a better heel strike with toes up, heel down, rather than, the first part of walking will be the whole foot, the entire foot on the ground, or very low toe angle, toe elevation in the first part of walking, because you can easily trip over if your toes are low to the ground every time you make each step. So please share this video to anyone you know who will benefit from it. Watch out for more videos that I will make for fall prevention, practical, very simple exercises that you can do at home. I'm in the process of writing my book about it. If you have any question, just email me at justuprightllc@gmail.com. And these are the references that I mentioned, and it's part of my presentation here. And again, thank you for watching, and stay blessed.